Hello, welcome to the 2025-26 VFC Provider Recertification. I'm going to go over the Provider Recertification Checklist. These are all the things that you'll need to complete. Make sure that everything's completed before you start the recertification process. So, first of all, you'll need to all the physicians signing the agreements, primary and backup coordinators are now all required to take the Chile training and the You Call the Shots trainings, modules 10 and 16. And you're also, you had received the VFC provider manual. So you'll also need to sign the provider manual acknowledgement form. All your training certificates and your acknowledgement forms need to be uploaded into NIMSIS before you start the recertification process. And then keep in mind that your email addresses must be 39 characters or less, no more 40 characters or less. It should be 39 and below. NIMSIS and our VTrack system will not accept any larger emails than those characters. So the next step you'll need to do is make sure and check that your current delivery hours are correct on NIMSIS. And remember that what is required is 1 day per week, other than a Monday, with at least 4 consecutive hours for those deliveries to be made. And then double check your clinic address and your shipping address if they're different. Okay, the physician signing the agreement will be the only ones that can get onto NIMSIS to sign the recertification. They were issued out their own username and passwords on February 24th and 25th. They were emailed to them with their instructions on how to sign the recertification. They are the only ones that can go in and sign it. Okay, so I will go over a live demonstration with you all with the step-by-steps. And other information to gather ahead of time would be your provider population numbers. If you are a data exchange provider, we have a report on NIMSIS that you can pull, which you can enter any 12-month period. And that is the VFC category patient count report. That is for data exchange. Any manual entry providers, you will be using any of the other data sources, which would be like benchmarking, Medicaid claims, doses administered, provider encounter data, or billing systems. And if you are a public health office, with your recertification information, you were sent a zip file. Since you enter into Transact, we pulled a 12-month period for you from the January 1st of 24 till December 31st of 24, so that you can use those numbers for your provider profile. So again, the public health offices will get their own zip file with these numbers. Okay, and the list of the prescribing staff members, we're going to get to a step on the recertification, and these are your prescribing staff members that either prescribe or administer vaccines, but they are not your primary and backups. Okay, so this is very important, and this is the step that a lot of our providers struggle with. So what you'll need to do when we get to this step is you'll need to take a screenshot of the list that comes up for your facility and place it in an email. And then you're going to either put by the person's name either to remain or remove, or if you need anyone added, you would put added and their name. And I will go over the information with you. We'll send that email to Felicia Martinez, and then she will go ahead and take care of it on the back end. And if you have any that need to be added, she'll get them out the paperwork from NIMSIS that they'll need. Okay, again, this is the 2025-26 VFC provider recertification. Again, in February, you were emailed our new Mexico Vaccine for Children Program Provider Manual. And there is the copy of the acknowledgement form that was attached to it that you will need to sign and upload into NIMSIS before you start your recertification. If you don't have the email with the form, you can also locate that on NIMSIS reports. Again, the new requirements is primary and backups coordinators are to be Chile trained, and now they're required to take the You Call the Shots module 10 and 16. And all certificates must be uploaded into NIMSIS along with that acknowledgement form. And also the new requirements that are located on page 44 of the provider manual, that your physician signing agreements are now to be trained in Chile, and the You Call the Shots modules 10 and 16. And all certificates need to be uploaded into NIMSIS, along with the acknowledgement form of the VFC provider manual. Okay, there are new instructions. These instructions are located on the reports tab on NIMSIS, and there are new instructions to change your PSA contact and the uploading training certificates. And there's also new instructions for VFC provider staff if you change the contact, and also the instruction to upload the training certificates into NIMSIS. Okay, your prescribing staff members, as I stated, our providers usually struggle with this part because it's kind of complicated, but your prescribing and administering staff members are located on NIMSIS, and they are located under the immunization tab. And you use the drop down where it says prescribed by. This is where the list will be. And this is what it's going to look like on the recertification. And again, I will go over it with you. Okay, so now I'm going to do a step-by-step live demo of the recertification process. So what we're going to do is we're going to go to the home screen. And then you go to your clinic tools and enrollment. Going to bring you up to this vaccine program enrollment page. You will go up to the top and hit add enrollments. And we are going to use right here the 2025-26 VFC certification. So you select that template. Okay. All right. So this is what you should see with your enrollment. Okay. So the first step is your enrollment guide. If you click on that, you'll need to open up the enrollment guide, and those are the checklists that I just went over with you. So this is the very first step. So if you haven't completed this, I would suggest you print it out, get everything completed on here before you continue with the enrollment process. Okay, so every time that you go through a step, what you'll need to do is save your progress to receive the green check here. Okay, that's also a tip, is to save your progress after each section in case you get called away for any reason in your clinics and you come back to do the recertification at a later time. If you save your progress, then you will not need to start over. If you do not save the progress, then you'll need to start all over from step one. Okay, and you can also close out each section by hitting the minus tab on the right hand side here. Okay, so your next step is the required staff and staff training. If you get this, requirements for this section have been met, then you did everything you were supposed to regarding your staff trainings that are on the checklist, and that is good. Okay, so now I'm going to show you what it's going to look like when some of the staff trainings are not completed or uploaded into NIMSIS. Okay, so let me go into this part for you. Okay, so if you see the yellow hazard sign and you click on your required staff and staff training, it's going to tell you what is missing, which this is that this states like there is not a physician signing listed, or the primary coordinator is missing their chili training, you call the shots. So this is going to let you know what trainings you're missing, and you'll need to complete them. Okay, so if you need to add a training, you can click here. It's going to prompt you to the clinic tools, and then you can follow along with the instructions that I had stated before. If it's your PSA, you follow the PSA instructions. If it is your primary or backup, you follow the primary or backup instructions step for step. And you can upload your trainings, or if you need to change the contact. If you click here and you complete the staff change, then you will need to give my staff 4 to 5 business days to approve before you can return to the enrollment to complete. Okay, so this is what it's going to look like if you do not have all your trainings completed and uploaded into NIMSIS. So now we're going to go back to the recertification process. And again, this is in a perfect world where you get all your trainings uploaded. So what we're going to do here is we're going to save that progress and close out that section. Okay. Your delivery hours, they're always going to be, if they are updated on NIMSIS and nothing has changed, you're going to have the green check mark on here already. But you still need to open it up and it'll say requirements for this section have been met. Save your progress and then close out that section. Okay, the next step is to review facility clinic information. And this is for your facility name, the vaccine delivery address, your PIN number, a phone number, and then your email address. That is all that we require with for VFC for your recertification on your facility. Again, if you have any edits to the phone number or fax number, you can click here, make your changes, and then you can go back into your recertification and complete. These do not need to be approved by the program. But if you make any changes to the provider name or the address, then you would click here, make your changes, and then you would need to give me 4 to 5 business days to see, verify the provider name change, or if there's an address change, that is there are other qualifications for that. So give me 4 to 5 days to contact you regarding any name or address changes. But if everything looks good, then what you'll need to do is click on the I confirm button and save your progress and close out that section. Your next step are your vaccines offered. Most of our providers are all ACIP recommended vaccine providers. We do have we do have specialty providers, and those are like your hospitals that just administer like Hep B or RSV, or high schools that only administer adolescents. So if you are a specialty provider, you can click there, and then you'll need to check off which vaccines that you do administer. Okay, but like I said, most of our providers are all ACIP recommended vaccine providers, so that's what I'm going to select. I'm going to save my progress and close out that section. Okay. The next step is your provider population. And this is where you will enter the children who are being immunized by their age group and their eligibility categories. Okay. And this is where your reports come from. Like I said, your data exchange providers will use the VFC category patient count report off of NIMSIS. Or if you're manual entry, you can use one of the other sources available. And if you're PHOs, you received your zip file and you will enter your numbers here. On this form, if you don't have any children that fall under any of these categories, you need to enter a 0 for them. Every box must have a number in it. And if you don't have any, then you use 0. So I'm going to just go ahead and put in some numbers here. And then we'll put 1, putting zeros because we have none there. And then every box is filled. It'll give you your grand total down here. Okay, so it's all filled up. We're going to go ahead and save the progress. receive the green check, and close out that section. Okay, and here is your source of data. So again, if you're manual entry, you would be using one of these other sources of data. If you are data entry, you would get that report off of NIMSIS. That's what we're going to say we did. Okay. And if you're a PHO and you received your zip file, then you can go ahead and click other for that. Okay. So we're using NIMSIS. I'm going to save the progress and close out that section. Okay. So right here is we're going to review the medical director or equivalent, which is your PSA. Okay, so you'll just need to check the name, their email address, their license number, and their title. That's all that we require. Okay, if something is missing or you've changed your PSA, then you'll need to click here on the submit change request. It's going to prompt you to the clinic tools, and you follow the directions for the PSA change of contact and uploading training certificates. And then you will need to give my staff 4 to 5 days to approve it. Okay. If everything looks good, then you can go ahead and check the I confirm button, save your progress, and close out that section. Okay. The next step is to review your vaccine coordinators, which are your primaries and backups. So you'll need to check their name, telephone number, and email address, and make sure that all their trainings are listed. Their Chile, that you call the shots module 10, 16, and their acknowledgement form. Okay, again, if you have any missing trainings or you need to change your primary and backups, you would click on this button. It's going to prompt you to the clinic tools. You make your changes using the provider staff instructions or uploading their training certificates. And again, give my staff 4 to 5 days to approve it before you can get back in and continue with your recertification. But if everything looks good and there are no trainings missing, you can go ahead and click on the I confirm button, save your progress, and close out that section. So right here, this is the prescribing staff member list. Please look at your instructions before trying to complete this section. If you notice on your instructions, there is a big red X. Do not press this button. Do not press this button. It's just going to prompt you to clinic tools, which is just going to be confusing for you. So if you follow the instructions, and that is letter K on your certification instructions, but there is your list. I only have one titled on here. You would need to take a snip or a screenshot of your list, put it into an email, put your PIN number and prescribing staff member list up on the subject line. And on the side, you will need to put either remain, remove, or if you are adding new prescribing or administering staff members, you would put it on the bottom and put add. Okay, please do not click this section. Okay, once your email is completed, you'll need to send it to Felicia Martinez. And again, on the instructions under letter K, there is her email address. She will handle it on the back end, and this will not stop you from completing your recertification. So once your email is ready to go or sent out, you'll need to just click I confirm the prescribing staff members, save your progress, and click on the close out that section. Okay, the last two steps, this is where you notify your PSA, your physician signing the agreement. They have received their own instructions on how to get in to sign, and they will be submitting your recertification to the VFC program for review for approval. So these two steps are going to be for your PSA. You're not going to see the sign button, and I'm going to go through them for you so you can see. You open it up. This primary agreement right here is to view the agreement. And this is on here just to review for your clinics and for the PSA to review to see what they are signing for, okay? This is, you can print it out to keep a copy of it. It's not fillable. It does not need to be completed, okay? And the Vaccines for Children agreement, these are the CDC requirements that they have for providers to become a VFC provider. So I would go ahead and print one out just to have a copy on file, but this is not fillable. You cannot fill it out. You should not fill it out. And you, as primary and backups, cannot sign for it. Only the physician signing the agreement. Okay, so that is the primary agreement. The secondary agreement is the New Mexico VFC provider addendum. And these are New Mexico's policies that we have in order to become a VFC provider. And we have updated it this year. So I would suggest that you print it off so that you know, and I will go over the new requirements. Okay, and that is number 6. So now that it states that I will enter all VFC and state supplied vaccine inventory into NIMSIS appropriately. I will perform regular inventories, which is once a month, reconciliations, and place vaccine orders on the same day. So now you reconcile and place your order on the same day, and you place them within your ordering time frame. Okay, the next thing that we added was number 9, that you will notify regional coordinators and complete the necessary paperwork for any planned temporary office closures. And this is basically like for schools that close for spring break, Christmas break, during the summer. Those forms must be completed, sent to your regional coordinators for approval, and vaccines need to be transferred out. Okay. The last thing that we added is that in the event of vaccine preventable disease outbreaks, upon request, that you will relinquish or transfer doses of vaccine needed to vaccinate individuals. And that means that if we do have an outbreak and we call upon your facility to transfer out doses, you must transfer them. You must transfer them to where we ask you to transfer them. You can't just say, no, I want to keep it in my stock. No, you'll need to transfer them out, and then we can replenish your stock. Okay, so I would make a copy of that. And again, this form is not fillable and it cannot be signed here. Okay, that is the last step on the recertification process. If you were to be denied for any reason, and you can see the last part of the instructions, if you're to be denied for any reason, what you'll do is you'll open up your comments and it'll tell you exactly what you're missing. You'll need to go back in and complete it, and then go ahead and save your progress, and then it will be reviewed again. Okay. And that is the recertification process. Thank you.